you know what hepatitis C is?
Not a clue.
I'm not real familiar with it, but I would say it affects the liver.
A disease of the blood is my best guess.
Well, hepatitis C is a virus that infects the liver, and after 20 or 30 years it can lead to cirrhosis and complications of cirrhosis to include liver cancer and the need for liver transplantation.
What is the easiest way, do you think, to get hepatitis C?
Blood transfusions, intravenous use.
I think people get hepatitis C from maybe intravenous drug use, dirty needles, things like that.
Well, hepatitis C is a blood-to-blood contagious disease. It's not given by casual contact. So the risk factors to acquire hepatitis C are getting blood transfusions prior to 1993, having any needle injected into you that you may not have known where it was from, be it IV drug needles, be it tattoos, piercings, acupuncture. Any needle that is not brand new and you don't know where it was from may give you a risk to acquire hepatitis C.
What do you think is the most common symptom of hepatitis C?
Well, I think I heard like spider veins you can see on people's bodies.
Some nausea, vomiting, jaundice.
I want to say jaundice, but is that kidney? No.
Fatigue.
Fatigue, all right.
People are often surprised when they find out there's no symptom that's very common in hepatitis C. The most common symptom is no symptom. The second most common symptom of hepatitis C is fatigue, and that's not very helpful because we've all had fatigue from time to time, and it doesn't mean we all have hepatitis C.
Do you know approximately how many Americans are affected with hepatitis C?
Roughly 3 to 4 million.
I know it's a large number. No, I don't know.
I would say there are probably millions that are, and a lot of them don't know it.
It turns out over 150 million people in the world have hepatitis C, and this includes 3 million Americans. Unfortunately, it's estimated that 75% of people who are infected are unaware they're infected.
What will hepatitis C do to you if left untreated?
I think it would destroy your liver. Well, if your liver goes out, then, death.
People often wonder what would happen if they didn't get treatment for their hepatitis C. It's important to realize that hepatitis C is a slowly progressive virus that infects the liver, and after 20 or 30 years can lead to complications of liver disease, including cirrhosis. Once you develop cirrhosis, you're at risk for liver cancer, liver failure, and other bad complications of liver disease.
How much alcohol is safe to drink when you have hepatitis C?
Probably none.
Probably, maybe, if any, 2 to 3 ounces.
Absolutely none, 0.
Well, we recommend no amount of alcohol is safe, as for different people, different amounts of alcohol can really lead to progressive liver disease. So let's stay away from alcohol if you have hepatitis C.
Do you guys think that there is a vaccine out there for hepatitis C?
Ooh, not sure.
I don't know about it.
The fact is, there is no vaccine for hepatitis C. However, there are vaccines for hepatitis A and B, and it's important if you have hepatitis C to be vaccinated for hepatitis A and B, because if you get infected with hepatitis A or B on top of hepatitis C, this can result in liver failure.
Do you guys think that hepatitis C is curable?
I would say yes.
Yeah, I'd say treatable. I don't know if it's curable or not.
The fact is, hepatitis C is readily curable today. In the last few years, exciting developments have occurred in drug development, and now we're moving to an era where we're using all-pill combination therapy for short durations of time with resultant cure rates above 90%. So yes, today hepatitis C is curable. That's why it's important to get screened and get diagnosed, because appropriate treatment should result in over a 90% chance of being cured from this infection that, if left untreated, can result in complications of liver disease to include cirrhosis, cancer, and need for liver transplantation, and may even shorten people's lifespan.